Hello and welcome to New Mouths Podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go! Welcome back to New Mouths Podcast. Today we're diving into a topic that's probably affected almost everyone at some point in their lives: toothaches. With me today is Jake, a dental expert with a wealth of knowledge on oral health care. How are you today, Jake?
I'm doing great, Sarah. Thank you for having me here. I'm ready to sink my teeth into today's topic.
Perfect. Let's get right into it then. We all know toothaches can be quite bothersome, but can you tell us exactly what causes them?
Absolutely. A toothache can have several triggers. It could be something as simple as temporary gum irritation or as distressing as an infection. You might have food caught between your teeth, an abscess, or even cavities that could be the culprits.
It sounds like these causes can vary quite a bit. How can someone tell if it's a minor issue or something more severe?
Well, the severity of the pain can be a good indicator. If you're experiencing a sharp, throbbing, constant, or even spontaneous pain, it's critical to see a dentist. They can determine the root cause and best treatment options for you.
And what are some common signs or symptoms of a toothache that our listeners should be aware of?
Common symptoms can include pain while chewing or drinking hot and cold liquids, swelling and inflammation around the tooth or gums, and sometimes even a swollen jaw or cheek. If the pain persists or gets worse, it's time to schedule a visit to the dentist.
I see. Is there anything one can do at home for temporary relief while waiting to see the dentist?
Sure, there are several remedies. A simple saltwater rinse can help with inflammation, or you can take over-the-counter pain medication. Applying a cold compress can reduce swelling, and natural remedies like clove oil or hydrogen peroxide rinse may also offer some relief.
That sounds quite manageable. Now, a common source of anxiety for many is whether or not you can die from a toothache. Can you shed some light on that?
That's an important question. While a toothache itself isn't fatal, it's the potential underlying infection that's worrisome. It can spread to the bloodstream if left untreated. That's why it's crucial to address dental infections promptly to prevent any serious health complications.
So prevention is key. What do you recommend for maintaining good dental health and avoiding toothaches in the first place?
The cornerstone of preventing toothaches is practicing proper oral hygiene. This means brushing daily with fluoridated toothpaste, flossing, using mouthwash, and of course, regular dental checkups.
Definitely sound advice. Before we wrap up, Jake, can you offer any last thoughts or tips for our listeners when it comes to toothaches?
Absolutely, Sarah. A toothache can be more than just an annoyance. It can be a signal from your body that something is wrong. Don't ignore persistent or severe tooth pain. Be proactive about your dental health and always consult with your dentist to get the right treatment.
Wise words, Jake. Thank you so much for joining us today and helping us understand more about toothaches.
My pleasure, Sarah. Thanks for having me. And remember, everyone, take care of your teeth and they'll take care of you.
That's all for today's episode on New Mouths Podcast. We hope you've gained some valuable insights into dental and oral health care. Keep smiling, and we'll catch you next time. That's all for today on New Mouths Podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.